Hello dear student, today we are going to deal with lipid lowering agent, or it is also called antihyperlipidemic agent, and these agents are used to lower the lipid into the blood vessel. Myself, Mrs. Urmila Ravindra Gaudi, MPharm in Quality Assurance Technique and lecturer in KK Wagh Institute of Pharmacy, Sandori. Let's start with Introduction of lipid lowering agent. First of all, we see what is hyperlipidemia. Hyperlipidemia is a medical term for abnormal high level of fats or lipid in the blood. There are two major types of lipid found in blood are triglycerides and cholesterol. Triglycerides are made when your body stores the extra calories and it doesn't need for energy. This is the diagram showing hyperlipidemia. That means in the blood vessel there is a deposition of fats or lipid. Therefore the blood flow decreases. Now atherosclerosis. Atherosclerosis is a condition. There is a narrowing of lumen of the blood vessel due to local accumulation of the lipid, complex carbohydrates, fiber, tissues, blood product and calcium deposited in the intimas of the large and medium size arteries. Here this is the blood vessel. In this there is a deposition of lipid, complex carbohydrates, fibers, calcium and cellular fabrics. Because of this accumulation or deposition, there is a decrease in blood flow, and this is result in atherosclerosis. The drugs which are used to lower the plasma lipid are called lipid lowering agent, and the examples are clofibret, niacin and nicotinic acid. Let's start with individual monograph. Now first of all we have to see clofibret. It was probably the most wide used lipid lowering agent. Most of the time for the lipid lowering agent we use clofibret. They can lower the blood cholesterol level. It is a branch chain acid derivative and it is a ethyl ester of 2-methylpropanoic acid in which para-chlorophenoxy group is present at C2 position. Properties: it is a clear, almost odorless, colorless liquid. It has characteristic faint acrid odor and has an acrid taste at first and then becomes sweet. Solubility: it is very slightly soluble in water but miscible in alcohol and chloroform. Storage condition: as it is a stable compound, it should be stored in tightly closed light resistant container. Now uses: it is used mainly to treat hypolipoproteinemia, again to treat hyperlipidemia, hypercholesterolemia and hypertriglyceridemia, and to reduce xanthomas, that means collection of cholesterol under the skin producing yellow discoloration, and for the prophylaxis of ischemic heart diseases. Dosage form: it is available in the form of clofibret capsule and the brand names are lipomide and atromides. Thank you dear student for attending the session. Thank you.